Hi, I'm Brooke, and I do my co-op at Stratford Midwives. And if those of you who don't know what a midwife is someone who cares for someone who is pregnant, in labor, and during birth, and then 6 weeks postpartum to the birth. So that means that they keep their care with the child until it's 6 weeks. So today I'm just going to show you how to put a birth box together. And the birth box is something that the midwives take to a home birth. So if a patient wants to have their child at home, then these are some of the things that they're going to need. So first I start off with taking everything out of the box to make sure that I have everything and know what things I do need and what are missing from the box. So I've laid everything out here. So first I'm going to start with the pads. So for the box you need 8 small pads, which are the blue, and then you need 2 large pads, which are the green. And the pads they lay them on the bed so it absorbs any water or any fluid from the birth. And then next you need the amni hook. And this hook is used to induce and make labor go faster. So what they do is they put this into the vagina and they puncture the amniotic fluid, so that makes the birth process go faster. And then I need the urinary catheter. They normally use this when a woman is having a cesarean section, which is a C-section, and they put this into the bladder and it lets the urine flow free. And then next I'm going to put in the peri bottle, and the peri bottle is used for women after they have the birth. Sometimes the women tear and it's painful to use the restroom, and when they go to the restroom it stings the sore spot. So what they do is they put warm water in this peri bottle and they squirt it when they go to the restroom to relieve the pain. Next is this large plastic Ziploc bag. They use this bag mostly just to put garbage in, because when you're taking things out of the package they need somewhere to put it, so that's why they have this bag here. And then I have the herbal bath. So this is called the herbal sitz bath, and the mother puts this in their bath after they have the child, because it relieves pain and pressure after you have the child, and it kind of gets your body to go back to the way it is, because there's so many drastic changes when you have a baby. And then next is the arterial blood gas sampling kit. So this is just a sampling kit for the blood gas count. And then next I have the IV bag. And with the IV bag, it's very important to check the expiry date, which is down here at the bottom. And if an IV bag is expired, then we put it in a box here and we send it to third world countries because they have use for them more than we would. So there's a box here full of the IV bags, and this is used to give the woman fluids if they need it and they're running low on hydration. And then next would be the IV tubing. So this hooks up to the IV, and the fluids go through the tube and it goes into the mother's system. And then next would be the IV tubing, which hooks the IV bag and the IV tubing, or this is the IV extension, so it'll hook to the IV bag and the IV tubing. And then we have the iodine prep pad. So this is used just to take the bacteria away when they put the IV in, or they give the mother or baby a needle, so then there's no bacteria that gets into the wound. And then I need this is the bulb syringe, and what they use this for is to take the fluid out of the nose and the mouth of the baby once it comes out of the womb. And then I need 3 sterile gloves. So I need 1 small pair and 2 medium pair, and the pairs of gloves come in 1 package. So this is 1 medium glove, so to make a pair I need 2 of these packages. So I have 4 packages of the medium gloves, that makes 2 pairs, and then I have 1 small pair of small gloves. And then next I need a straw. And this straw is used just to give the mother water. so they always need a bendy straw so they can sip and they're not uncomfortable, and the straw can be pointed towards them. And then we have a tape measure for the midwife to measure the baby and the head circumference when the baby comes out. And then I also need the mesh underwear. So this underwear goes on the woman after she gives birth, and what they do is they put a pad on and put things on to stop the bleeding if there is any, and then they put this on top so the pad doesn't fall off. And then next I need, there's 3 little baggies here. This one has non-sterile gloves, and then it has a tegadermy, and then a tourniquet. And then I need 3 angio-cath needles, and they're 18 gauge. I need cotton balls, Band-Aids, alcohol swabs, and tape. And that's one of the little bags full of things that we need. And then I zip it up, and I like to take all the air out of it because there are more things to put in this little tiny box. And then next is the RH negative kit, and RH stands for Rogaine. So in this bag, it consists of a 10 cc syringe, a needle holder, a tourniquet, and then I have the 18 gauge needle, and then I need 2 purple blood tubes, 1 red blood tube, and 1 pink, some alcohol swabs, and some Band-Aids. And then the last thing that would go in here are the cord blood labels. And next, I need the RH pack, again for Rogaine. And in this pack, you need 1 Vacutainer needle. I need 1 cc, 1 cc gauge needle, and then a 3 cc gauge needle, some alcohol swabs, and some Band-Aids. And then next we put into this little bag would be, this is a welcome home package for the mother, and what goes in here is, this is a Lanish, and these are pads that go in your bra because when you have a child, your milk will drop and sometimes you will leak. So these are pads, and then this is a wipe if the nipples are cracked and sore or dry. So you just wipe that and it'll make it soft. And then there is a Is Your Child Safe booklet for mothers to read. Immunization booklet so the mothers know when to give them which immunization. And then there is a homemade diaper wipe instruction. And then a DVD that's called The Period of Purple Crying. And this is just a DVD for mothers, and it's a new way to understand why babies cry and to know that you shouldn't be worried, and that babies do cry severely sometimes for different reasons. And then in this booklet there is some information from the district Perth Health Unit, and there is your immunization records in here, and some reading information for the mothers to read for when their babies start breastfeeding. So that is what's in this little booklet. And then what also goes in this home birth package is 2 little hats. And these will be the first thing that the baby will wear. And then I put this information package into the box. And then there's one last little package, and this is another package that goes with it. And in here is a newborn diaper and some wipes and some more information on baby brands and things that a mother can get for their child. So a midwife will always come in here and they will come and get the birth boxes, and they know that they're finished if they're put on this shelf here. And also what goes along with it is oxygen tanks, because you never know what's going to happen at a home birth. And then I probably make about 4 or 5 of these a week. It all depends on how many clients that we have in care and when their due date is. So sometimes it could be a spontaneous birth and they just have to come in here and get one of the home birth kits.